It's being called an historic day in the fight against the coronavirus. COVID-19 vaccinations have begun in countries across the European Union. The vaccine is seen as the first significant step forward in a crisis that has elevated health workers and scientists to the rank of heroes. Now it's the turn of a new type of hero to roll up their sleeves, with Europe's most elderly lining up for the vaccine.
Celebration as Spain vaccinates its first person against the coronavirus. It's a moment of hope in one of the countries hardest hit by the pandemic. In Italy, medical staff were the first to get the jab, their country too ravaged by the first wave of the virus.
Having been on the front line since the beginning of the pandemic, I have felt with my hands and seen with my eyes how difficult it is to fight this virus. It has been painful to witness the defeats this virus has caused, but today is an important and decisive day.
In the Czech Republic, Prime Minister Andrej Babis led the way. And he was followed by a World War II veteran who took it all in her stride.
It pricked a little, that was all.
While in Sweden, the first was a 91-year-old retirement home resident. Supply of a vaccine is limited, but demand is huge. With most EU countries receiving an initial batch of no more than 10,000 doses, each member state is prioritising who gets the jab. Further supplies are expected in the new year, but officials warn there's a long way to go before everyone can be vaccinated.
Our Brussels Bureau Chief Alexandra von Namen is standing by for us in Brussels. Alexandra, a historic day in the fight against this pandemic. What's the EU's role in this vaccine rollout?
EU Commission President Ursula von der Leyen described it as a touching moment of Europe's unity. And this was exactly what the European Union was aiming for in this phase of the fight against the coronavirus. The member states could have moved forward individually, but instead they decided that it is the European Commission talking to pharmaceutical companies, procuring vaccines and coordinating the rollout of vaccines now across the continent, across the bloc. And it was important to make sure that every member state is getting vaccines at the same time and that even poorer member states are not being left behind, left alone with that.
And countries like the US and the UK have already begun vaccinating people. Why did it take the EU longer to get there?
It took longer, indeed, and the reason for that was that vaccines in the US and in the UK were approved under the emergency use authorization. The European Union decided to approve them under conventional market authorization. It was because of questions of liability, if there are any serious side effects, and it was also meant as a signal to show that the vaccine is safe and to convince those who are still skeptical that it's safe and right to get vaccinated.
Now, something that won't help skeptics, I suppose, the head of the European police body, Europol, has warned against the danger of potential fake coronavirus vaccines. What more can you tell us about that?
Well, that's true. Europol has been warning of fake vaccines for a while now, saying that there is a danger that organized crime could try to sell counterfeit vaccines or try to hijack shipments of genuine vaccines. And that is, of course, because we don't have enough doses and there are people maybe desperate to get vaccinated who would buy a vaccine on dark web. So that is why Europol is warning member states to stay vigilant because there is a real danger that criminal minds could try to sell fake vaccines.
All right, Alexandra von Namen speaking to us from Brussels. Thank you for that update.
And here in Germany, where infections and numbers of COVID deaths have reached record highs in recent weeks, one care home decided it didn't want to waste any time after taking delivery of the vaccine. A 101-year-old woman in the state of Saxony-Anhalt was the first to get the shot a day earlier than scheduled. Those in the highest priority group include people over 80, as well as residents and staff of care homes. And Kate Marder is standing by for us at the largest retirement home in Cologne, Germany, of course. Kate, what's happening right now where you are?
So just behind me is the first woman who got vaccinated here today. She's a 92-year-old lady named Frau Vogel, so Mrs. Vogel. And yeah, she was vaccinated today, the first of 110 residents here at Cologne's largest care home, where there's 1,100 residents. So she was the first of many, and everyone here who will get vaccinated, everyone here who wants to get vaccinated will be able to do so in the coming days. But just today, there'll be 110 residents here vaccinated and a number of staff as well.
And can you tell us a little bit more about how people are reacting to this news and having, I guess, the media there and this event unrolling in their own care home?
Yeah, everyone was really, really excited today. And Frau Vogel, Mrs. Vogel herself, was also really happy. As soon as she had the vaccination, she pulled down her face mask, like my one here, and she did a large smile. And everyone was very, very happy about that. And I spoke as well to the woman, the head of the care home here as well. And she said that she was very excited that her care home had been the first one chosen for these vaccinations to happen. And she said that a lot of hard work had gone into preparing the vaccine and making sure all the preparations were right. And that took place through Christmas, but she called it an early Christmas present.
Yeah, and we can well imagine why. Thanks for that. Kate Marder reporting for us from Cologne. And to shed a little more light on this historic day, we're joined now by Andrej Ullmann from Würzburg. He's a member of the Bundestag for the business-friendly FDP party and a member of the German Health Alliance Advisory Board. Mr. Ullmann, welcome to the program. The European Commission President says this is a touching moment of unity for Europe. Is it?
I would say so. I think it's a very touchy moment since for the first time in human history, we are combating a pandemic, an acute pandemic, with a newly evaluated and approved vaccine. And I think that is a major step in humankind.
Germany, where we're both living and talking in lockdown of one kind or another, didn't deal with the second wave of the pandemic as well as the first. Why is that?
Well, I think there was a certain kind of ignorance on one side and some kind of a hopefulness that this nightmare would pass by without any consequences. I think that was a big blind spot by the German government, and we see it right now with the very high infection rates, and especially the vulnerable groups are especially hit hard. They are in the ICU, being on the respirator, or even dying because they were not well enough protected. I think there has to be a lot of workup to be done afterwards why that happened, because it was always clear that we're going to have a second wave. We wanted to prevent a second lockdown, and it was very important for us to prevent any kind of infection, especially in nursery homes for the elderly, and I think there was a lot of things that were missed.
Right. You're a member of Parliament. Tell me, is there not a form of structural political weakness in Germany vis-a-vis pandemics? Chancellor Merkel had a very hard time getting regional leaders to agree to a lockdown. Has that shown up weaknesses in the federal system, do you think, that need fixing, perhaps?
I think once this pandemic is over, we have to discuss the federal system in Germany in regards to pandemic preparedness. It is very clear that we were not prepared for the pandemic in March of this year, and we were not prepared for the second wave at all very well, because health care and health systems are in the responsibility of the different states in Germany. And of course, there were certain kinds of minister presidents that were very much interested to see how strong they are, but they actually demonstrated more weakness because the unity of our country, or even within Europe, wasn't guaranteed. And it caused a lot of, let's say, a mess up in prevention measures that were done in our country.
Thank you for that insight. Andrej Ullmann, member of the Bundestag and the German Health Alliance.
Thank you for having me.
And here in Germany, the immunization campaign is already underway. With vaccine doses still in limited supply, the government has prioritized who will go first. Those in the highest priority group include people over 80, as well as residents and staff of care homes. Frontline medical personnel in intensive care units and emergency services and others in contact with high-risk patients also get priority. After that, the vaccination will be given to people over 70, doctors and medical staff in regular contact with patients, as well as people with mental disabilities. Everyone else will have to wait. It's not yet clear how the rest of the population will be prioritized. The question remains just how long it will take for enough people to be vaccinated for life to return to some kind of normal.
Now let's head to Italy, where there's a massive vaccine rollout. Joined by DW correspondent Seema Gupta in Rome. Seema, the vaccine program now underway there. How's it going?
Yes, it's kicked off this morning with the first 5 people being vaccinated here in Rome. A nurse, a virologist and other healthcare workers were the first to be vaccinated in an infectious disease hospital here in Rome. Now, it's rather symbolic because, of course, this hospital was also where the very first cases were treated back in January for COVID-19. The Prime Minister, Giuseppe Conte, calling the fact that this date, the 27th of December, will go down in history. Italy, of course, having suffered greatly at the hands of COVID-19. More than 71,000 people have died due to this virus in this second wave. The number of dead is higher already than that first wave. More than 2 million people have been infected with COVID-19 here. Now, the health minister said that this is the first sign of light that they're seeing, but you cannot let your guard down. The vaccine doesn't mean that you can stop the mask or stop the social distancing or washing hands. He said all of that has to continue. 9,750 doses of that Pfizer vaccine delivered across the country, the largest number of doses going to that hardest hit region of Lombardy up north.
Well, Italy is, of course, one of the hardest hit countries in Europe. You mentioned some of those alarming numbers. Is there enough vaccine to bring about a change in the spreading of the virus in Italy?
Well, what the authorities are saying is that they've ordered a total of 202 million doses. Now, that includes Pfizer as well as all the other different companies. They expect the vaccines from Moderna to come in early January as well. They've got 21 centers where they're going to hit out for the initial doses. And eventually, you're going to see a massive program, a campaign, if you like, to inform people about why it's important to do this vaccine that's free and non-mandatory, but is very much encouraged. And some 1,500 vaccination pavilions are going to be set up in piazzas or squares around the country to administer these doses to the general population. The first, though, will go out to those healthcare workers as well as those in nursing homes and those over 80, eventually going down to those over 65, as well as teachers, policemen, those in the front line who are most exposed, and eventually to the general population. The scientists believe that by September, you will have an element of normalcy, if you like, in the country. But of course, it's still early days and still early hours, really, in this program.
All right, Seema Gupta, speaking to us from Italy, have started their vaccination program today. Thanks very much.
And for more insight on the rollout across Europe, I'm joined from Seville by DW correspondent Jan Philip Schultz. Jan, Spain, as we heard and as you know full well, was one of the worst hit countries in Europe. Is there enough vaccine there to change things fast enough?
Well, from today on, Spain will receive 350,000 doses every week. They will be brought to a hub in the center of the country, and then they will be distributed to the different regions. It's probably enough for the most vulnerable group, for the care home residents and the staff of care homes. They have been the hardest hit. 10,000 of care home residents have died here in Spain. So the government is hopeful that there's enough vaccine for them so that the majority of them will be covered in the next 12 weeks.
And how are people in Spain reacting to the vaccination campaign? I imagine there's some relief, but are people keen to get inoculated?
Well, according to the latest surveys, most Spaniards are quite optimistic. A lot of them think it's the famous light at the end of the tunnel. And if you speak to people on the streets, they also say they think it's a good idea that it's a concerted effort in the European Union. Accordingly, there was a slight irritation yesterday when news spread that a few places in some countries, including Germany, started already with the vaccination. Of course, the agreed official date is today, so there was slight irritation, but now everybody is looking forward to the program and is hopeful that this will be really the last phase of the pandemic now.
All right, DW's Jan-Philipp Schultz in Seville. Thank you for that. And another hard-hit country in Europe has, of course, been France. And we're joined now from the French capital by DW correspondent Sonia Falnikar. Sonia, thanks for being here. How is the vaccination program being rolled out in France?
Well, so France has indeed begun with its vaccinations today, though I have to say on a very small scale. Only about a dozen people in a few nursing homes near Paris and near Burgundy were the first to get vaccinated today. That included a 78-year-old woman in an old age home in Sèvres near Paris. And this is very much in line with what the French government has been saying, namely that it will carry out these vaccinations in a slow and phased out manner, starting with the most vulnerable group, that is high-risk elderly patients and the people who care for them in the country's 14,000 nursing homes. And we have to remember these nursing homes also accounted for a large number of the more than 60,000 deaths that we've seen in France so far linked to the coronavirus.
France, as we know and you know, stands out not just for the high level of coronavirus cases, but also the high level of coronavirus and vaccine skepticism compared to other European countries. What's being done to counter that, to have this rollout succeed?
That is true. I mean, many people here remain deeply skeptical of the vaccine. And according to the government's own most recent health survey, just about 40% of the French population say that they will get the vaccine. So this is deeply worrying. The government has really responded by saying that they will not make the vaccine compulsory. This week, we saw French Health Minister Olivier Véran saying that France will not be rushing into this campaign. He's made it clear that anyone who opts for this vaccine will receive a medical consultation. They will get information about the vaccine. They will have to give their consent. And he says all this is an attempt to boost confidence in the vaccine. Health officials here have also been saying that they will publish a report every week with any possible side effects which have not been reported earlier in clinical trials. So I think the French government is really making a big effort to tell people we're taking your concerns seriously. We're moving very slowly with this, but we do hope to take everyone on board.
Okay, DW's Sonia Falnikar in Paris. Thanks for that insight.
Hungary also started vaccinating ahead of the EU schedule, starting with its hospital staff, also using the BioNTech Pfizer vaccine. It got its first shipments of nearly 10,000 doses. The government is prioritizing frontline healthcare staff. The first worker to be given the shot was a senior physician at Budapest's Central Hospital. A mass vaccination program is then planned for early 2021. And for more on this, let's turn to journalist Stefan Boss in Budapest. Stefan, Hungary is starting its vaccinations ahead of many other EU countries, as Germany has, we've just heard. What's behind that reasoning?
I think behind that reasoning is that the Hungarian Prime Minister Viktor Orban, who has been criticized by the opposition over his perceived lacking in the coronavirus pandemic measures, that he wants to show that he is still in control. And I think it's also a message towards Europe. He had a very tense relationship with the European Union, and he wants to show them that Hungary can stand its own and we can care for our people. Now, at the same time, of course, time is running out, critics say, because the death toll is actually rising here. There are almost 9,000 people reportedly died with or because of coronavirus on a population of nearly 10 million people. But that is, I think, also behind the reasoning for the Prime Minister to do this tonight and today.
It's also not the first time that Hungary has been in the news about its vaccination plans. When it came out that Hungary was actually going to go a different way from the EU, not wait for that BioNTech Pfizer, maybe go with the Chinese or the Russian vaccines as well. What more do you know about that?
Well, what I know is that, in fact, already some Russian doses of that Sputnik vaccine arrived here in Hungary. They have been testing it. And if it's up to the Hungarians, they will roll out that very soon. The same they are saying about the Chinese vaccine as well. And as Hungary is concerned, there's nothing wrong with doing that. Now, of course, there are people disagreeing, including the European Union. They say these vaccines should be tested much better. But of course, there is a loophole in legislation also within Europe. And that's, I think, that loophole will be used by the Prime Minister to bring more vaccines, perhaps even here behind me in this hospital, as was done today with the Pfizer vaccine.
What's been the public reaction there to these various kinds of vaccines? Do people seem like they're going to want to step up to get it when they can?
Well, it's depending on with whom you talk. I've been speaking with several Hungarians, and they say, I don't want to be vaccinated. They are very concerned about it, to be honest. But of course, if you speak with elderly people, they might appreciate it. I think also what we could hear today is that the frontline workers, they are very happy that the vaccines arrived. They say many of us were infected, in fact, with COVID-19. That's also in part, I have to say, because there is a rundown health system in Hungary. So it depends on who you talk, but I think many people are happy tonight.
Stefan Bos in Budapest, thanks very much.